Mental health is essential. It's just as important as physical health. Governments and policies play a big role in making sure people can get mental health care. This essay explores how government policies and programs shape mental health services. Imagine a world where everyone has access to the mental health support they need. It's a world where people can thrive, not just survive. Governments are crucial in making this vision a reality. By creating and enforcing policies, they can ensure everyone has a fair chance at a mentally healthy life. But it's not just about governments. Non-governmental organizations, NGOs, also play a crucial role. These organizations often work on the ground, providing direct services to those who need them most. They fill in the gaps, offering support and advocacy where government programs might fall short. This collaborative effort between governments and NGOs is essential in tackling the complex challenges of mental health. Together, they can create a safety net that catches people when they fall and empowers them to rebuild their lives. Mental health challenges are a global concern. They affect millions of people, regardless of their background, age, or social status. These challenges can manifest in various ways, from anxiety and depression to more severe conditions like bipolar disorder and schizophrenia. The impact of these conditions extends far beyond the individual. They touch the lives of families, communities, and entire societies. Untreated mental health issues can lead to lost productivity, strained relationships, and even tragic outcomes like suicide. The good news is that mental health conditions are treatable. With the right support, people can recover and lead fulfilling lives. This is where governments and NGOs step in, providing a lifeline for those struggling with their mental well-being. By understanding the scope of the challenge and the impact it has on individuals and society, we can begin to appreciate the critical role that governments and NGOs play in addressing this global issue. Their work is not just about treating illness, it's about promoting well-being and building a more compassionate and supportive world. Governments hold the power to shape the landscape of mental health care. Through their policies and programs, they can create an environment where mental well-being is valued and supported. One of the most important roles of government is to ensure access to mental health services. This means making sure that everyone, regardless of their income or social status, can get the help they need, when they need it. Another crucial aspect is tackling the stigma surrounding mental health. Governments can use their platforms to raise awareness, challenge misconceptions, and promote understanding. By fostering a culture of openness and acceptance, we can encourage people to seek help without fear of judgment. Furthermore, governments have a responsibility to invest in research and innovation in the field of mental health. By supporting scientific advancements, we can develop more effective treatments and prevention strategies. In essence, governments act as architects, laying the foundation for a society that prioritizes mental well-being. Their policies and programs provide the framework for a system that supports individuals and families facing mental health challenges. In many countries, the responsibility for mental health care is shared between the federal and state governments. This division of responsibility allows for a more tailored approach, addressing the unique needs of different regions and populations. The federal government typically sets national standards, provides funding, and oversees major initiatives. This might include things like setting guidelines for mental health parity in insurance coverage or funding research into new treatments. State governments, on the other hand, are often responsible for implementing and administering programs at the local level. They might manage state-run psychiatric hospitals, oversee community mental health centers, or provide funding to local NGOs. This dual system allows for both a top-down and bottom-up approach to mental health care. The federal government provides overarching guidance and support, while state governments can tailor programs to meet the specific needs of their communities. However, this division of responsibility can also present challenges. Sometimes there can be inconsistencies between federal and state policies, leading to confusion and gaps in service. These gaps can result in individuals not receiving the care they need. It's crucial for these two levels of government to work together seamlessly to ensure a cohesive and effective mental health care system. By collaborating effectively, they can create a more unified approach that benefits everyone. Success stories from various regions show that when federal and state governments collaborate well, the outcomes for mental health care can be significantly improved.
Federal governments play a crucial role in shaping mental health care by implementing nationwide initiatives and programs. These initiatives often focus on key areas such as research, prevention, and improving access to care. One example of a significant federal initiative is the establishment of a national mental health hotline. This provides a readily accessible resource for individuals in crisis, offering immediate support and connecting them with local resources. Another crucial area of focus is funding research to better understand mental health conditions and develop more effective treatments. By investing in scientific advancements, federal governments can pave the way for breakthroughs in diagnosis, treatment, and prevention. Federal governments also play a vital role in enacting legislation that protects the rights of individuals with mental health conditions. This includes measures to prevent discrimination in employment, housing, and healthcare. Through these initiatives and legislation, federal governments demonstrate a commitment to prioritizing mental health and ensuring that individuals with mental health conditions have the same opportunities as everyone else.
While federal governments set the stage for mental health care, state governments play a vital role in tailoring solutions to the specific needs of their communities, ensuring that the care provided is both relevant and effective. This localized approach ensures that programs are not only relevant, but also accessible to the people they serve, addressing the unique challenges faced by different communities. One way state governments address mental health needs is by establishing and funding community mental health centers, which serve as essential resources for those in need. These centers act as hubs, providing a wide range of services, including therapy, medication management, and crisis intervention, all under one roof. States can also implement programs tailored to specific populations, such as veterans struggling with PTSD or youth experiencing early signs of mental health challenges, ensuring that these vulnerable groups receive the specialized care they require. By addressing the unique needs of these groups, states can provide more effective and culturally sensitive care, which is crucial in a diverse society. Furthermore, state governments can play a crucial role in training and supporting mental health professionals, ensuring they are well equipped to handle a variety of mental health issues. By investing in the workforce, they can ensure that there are enough qualified providers to meet the growing demand for services, which is essential for maintaining a robust mental health care system. Through these localized efforts, state governments act as crucial partners in building a comprehensive and responsive mental health care system that meets the diverse needs of their residents, fostering healthier communities overall.
Non-governmental organizations, NGOs, play an indispensable role in the mental health landscape, often bridging the gaps left by government programs and providing vital services to underserved communities. These organizations are often the unsung heroes, stepping in where resources are scarce and needs are high. These organizations are driven by a mission to support individuals with mental health conditions and advocate for their rights. Their commitment to this cause is unwavering, and their efforts are often fueled by a deep sense of empathy and understanding. One of the key contributions of NGOs is their ability to provide specialized services that might not be readily available through government programs. These services can range from individual therapy sessions to group support meetings, each tailored to meet the unique needs of their clients. For instance, some NGOs focus on supporting specific demographics, such as LGBTQ+ youth or refugees, who may face unique challenges and require tailored support. These groups often encounter barriers that mainstream services may not adequately address. NGOs also play a crucial role in raising awareness about mental health issues, combating stigma, and advocating for policy changes. Their campaigns often reach deep into communities, spreading knowledge and fostering a more inclusive environment. They often act as the voice of the voiceless, bringing attention to the needs of individuals with mental health conditions and pushing for greater understanding and support. Public events and demonstrations are just some of the platforms they use to amplify their message. Moreover, NGOs often operate with a grassroots approach, working directly within communities to provide support and resources. This hands-on method ensures that they are not just seen as service providers, but as integral parts of the community fabric. This close connection to the communities they serve allows them to tailor their services to meet specific local needs and build trust with individuals who might otherwise be hesitant to seek help. Trust is a crucial element in mental health support, and NGOs excel in fostering it. In essence, NGOs act as vital partners in the mental health ecosystem, complementing government efforts and ensuring that no one falls through the cracks. Their collaborative efforts with government agencies help create a more cohesive and comprehensive support system. Their dedication, compassion, and specialized services are essential in creating a more supportive and inclusive society for individuals with mental health conditions. The tireless work of NGO staff members is a testament to the impact that these organizations have on the lives of countless individuals.